Hi, I'm Rick Pollock, President and CEO of the American Hospital Association. Welcome to a special edition of Advancing Health. For more than a year, we've seen heartbreaking images as the war rages on in Ukraine. These include newborn babies being moved from the neonatal intensive care unit of a hospital to a makeshift bomb shelter in a basement and the destruction of healthcare facilities. Still, many Ukrainian healthcare workers continue to provide much needed care to fellow citizens. However, their ability to provide this care has been severely limited by the tremendous damage the war has inflicted on Ukraine's healthcare infrastructure. We're pleased to share with you an interview of how Chris Manson, Vice President for Government Relations at OSF Healthcare in Illinois, is making a difference. You'll hear during this conversation with AHA's Alex Rosenbaum, who is a key member of our team and is also a native of Odessa, Ukraine, how a question from Chris's daughter led him to spearhead a tremendous humanitarian effort to deliver much-needed ambulances and medical supplies to Ukraine. Thanks to Chris's leadership, 28 ambulances, 1 fire truck, and countless medical supplies have been delivered to healthcare workers and first responders in Ukraine, and more are on the way. We wanted to share Chris's story with you and provide an opportunity to help the Ukrainian people as they continue to care for the sick and injured, and provide healing and hope in their struggle to protect freedom and democracy. Thanks so much, and thanks to Alex and Chris.
Welcome to a very special AHA podcast, which will focus on an incredibly humanitarian effort to war-torn Ukraine. I'm Alex Rosenbaum, Senior Director of Product Development, Product Strategy, and Partnerships at the AHA. This podcast is especially near and dear to my heart. I was born and raised in Odessa, Ukraine, a city known to many around the world as a pearl of the Black Sea. As the war in Ukraine has raged on for this past year, Odessa has been bombarded numerous times, numerous civilians casualties, infrastructure damage. I could have never imagined that in the 21st century, after the atrocities that we witnessed of World War II, that we could ever see a war like this on any soil. And so this tragic war has brought out the worst and the very best in some people. Today it is with great pleasure that I welcome one of those special individuals, the very best, from OSF Healthcare, Chris Manson, the Vice President of Government Relations. Chris, welcome to this podcast. It's great to have you here.
Well, thank you. It's a pleasure to be here, and happy to get to talk to you a little bit about what we're doing today. So thank you very much.
It's absolutely our pleasure, and welcome. So let's kind of get started. Let's maybe begin today's discussion just by learning a little bit about your organization and who you are and what you do there.
Yeah, so I'm the Vice President of Government Relations for OSF Healthcare. And I've been in healthcare for almost 17, 18 years. So, technically I've been a part of AHA for 17, 18 years, right? Go to the annual meetings and DC and do the legislative stuff. So, but yeah, so that's my role. OSF Healthcare is a 15 hospital health system, Catholic health system based out of Peoria. We have hospitals in Illinois and Michigan. And I've had the pleasure of being their VP of Government Relations for the past 6 years.
And thank you very much for all, everything that you do in the field and for coming to our events and being part of AHA. So we're, very appreciative of that. And I think what everyone is going to want to hear today is, really, how did you get, started here with this incredible drive for the ambulances to Ukraine? Like what got you started, Chris?
Well, so, back in, unfortunately, at the end of February 24th, when the full-scale invasion kicked off with Russia invading Ukraine, probably like many people, I would watch the news with my in this case, my daughter. And as we'd watch the news, I'd try and turn the channel before, anything too bad would get on and everything. But even as a 7-year-old, she's sharp enough to pick up there are really bad things happening in this country. She saw the children being separated from their parents. She saw buildings bombed. I mean, just completely unjustified violence that was happening, and we were seeing it on TV. And so at some point, in late February, early March, it obviously got to her, because as we'd sit down for dinner to say we'd say a blessing before we'd eat, she'd say, "Hey, can we pray for the people of Ukraine?" And so we knew right then, like, okay, this is impacting her, bothering her. So I kind of kept an eye on her, and we'd talk a little bit, and I could tell she was still a little bothered. And then one point in very early March, we were talking, and she said, "Hey, Dad," and I said, "Yeah, what's going on?" She's like, she indicated she was still pretty upset about what was happening, and she just said, "I know we were praying for him." And she's like, "Yeah." She was, "Do you think there's something we could do to help the people in Ukraine?" And so, I mean, that kind of hit me, and I kind of went away thinking about that, and I actually, believe it or not, I was going to an AHA government relations meeting. It would have been March 7th of 2022. And as I was on the plane, I was thinking about that. And I was like, well, I work in healthcare. I used to be in the military. I used to be a volunteer firefighter. So I was just trying to connect some dots and figure out what could be done. And after seeing some images of ambulances being destroyed, somewhere between Chicago and Washington D.C. on an airplane, kind of landed on the idea of like, hey, I wonder if I got an ambulance, and if I could get my health system to put some supplies in it. If I wonder if the Ukrainian government would want that. And so it kind of landed on that idea, on a plane somewhere between Chicago and Washington D.C. on March 7th, and that's kind of how it started.
That's an incredible story, Chris. I mean, that's truly an incredible thing of how compassionate your daughter is, and how heartfelt it must have been for you, but also just the the receptivity and awareness of what's going on in the world. One other thing that I think I've mentioned this to you, but I think around Ukraine and a lot of Ukrainians, you're known as the ambulance guy. I'm not sure if you know this, but this is actually how I learned, of you from the Ukrainian council in Chicago, Evgeny Drobot. He goes, "Alex, do you know the ambulance guy?" And I was like, "No, Evgeny, I'm not sure I do, but if you let me know who this is." And so I'm so grateful that he put us in touch, and it's amazing. And one of the things that, as you and I talked over the last several months, I realized how complex this process is, and has been, and it is still for you. Can you share a little bit about what are the different steps, and how do you actually obtain an ambulance, get it ready, get it prepped? Because a lot of our listeners, a lot of our AHA members, and I'm sure they'll want to reach out to you and get involved with this, and we'll talk about this at the end of the podcast. But just share how complex this has been.
Well, I will tell you right now. So right now, almost, well, today's the 9th. So about a year since that first that idea, we now have 28 ambulances in Ukraine, and we have one fire engine in Ukraine right now. So, and really, what it starts with is with the generosity of people, and the generosity of people in the United States. I got to tell you, um, I made a phone call to an ambulance provider in Illinois, and I made two phone calls. One, I called my employer and said, "Hey, I feel like I got to do something, and I explained what I wanted to do, and I'm like, if I can get this done, would OSF help?" They said, "Absolutely. You're feeling a calling. We want to help. Let's make this happen, and we'll fill it up with supplies." So that was one. The second question was to the ambulance provider, and I called him and I explained what I wanted to do. And his only question to me was, well, "What do you want, gas or diesel?" He didn't ask me to explain myself. He didn't ask me to defend it. He didn't
Love
ask me,
it.
"What do you want, gas or diesel?" So, and I hit on that whenever I talk to anyone, because there's just so much negative stuff that you hear about day to day. And, it could be anywhere in the world, but it's just, there's a lot of bad stuff, but there's a lot of good stuff. And none of this would be possible unless there were so many people that were so generous. So just, I want to level set that this wouldn't happen without the kindness and generosity of a lot of people. So once, what we do is we get in, what we've done is we put a call out pretty much as wide as we can to fire departments, hospitals, health systems, private ambulance providers, and now we're shipping fire engines as well. So again, the fire departments, and basically the ask is, or the call to people would be, hey, do you have an older or old ambulance or fire engine that you're looking to retire? In your normal course of business, it's on its way out. Have you gotten some new ones in? And this is now the backup to the backup, and you're really paying to store it more than anything because you really don't use it that often. And the beauty of it is the way most ambulance businesses and fire departments and hospitals run their ambulances. They take really good care of them. I mean, even the older ones, you do daily inspections, weekly inspections. So you might have an ambulance that's older, but it's maintained. Same thing with the fire engines. So we identify that. We've identified a vehicle, or we put the call out. And so once we have the vehicle, I'm very lucky to be able to work with, for example, the Ukrainian consulate in Chicago, the Ukrainian government itself out of Kiev, and then many amazing Ukrainian Americans here in the United States. I've partnered up with a couple different organizations, the Ukrainian Medical Association of North America out of Chicago, and the UA Resistance Foundation, which is who I'm working with to help me ship my ambulances now. And when we identify a vehicle, we can get it picked up anywhere in the country. We either get brought to Chicago, or we now have a place in Virginia. We have a second facility in Virginia, so we stage it there. And then while we're collecting the vehicles, people are almost simultaneously, people hear about the ambulances being collected, or someone that donates knows a friend, and they talk to people, and then so all of a sudden I will get calls. Do you need a gurney? Do you need other supplies? Do you need a cardiac monitor? And the answer is yes. And what we try to do is we try to send every ambulance completely as outfitted as we possibly can. We don't send drugs, but basically it's ready to go on a call if we're going to go on a call. So it's got the gurney, hopefully it's got a cardiac monitor, it's got an AED, it's got everything in it. And then in addition to that, then we will overstuff it. So then we just basically use the ambulance as a container.
I've seen those pictures, Chris. Yeah, no, I mean,
Yeah.
they were full to the, to the
top.
ceiling.
Yep.
To the
Yeah.
top.
And
Absolutely.
sometimes you'll get, a bunch of sutures, or you'll get just tons and tons of trauma dressings. Or, I mean, gosh, one of the things that hit me probably the hardest when we did this, OSF donated, one of the things that was asked for by the Ministry of Health in Kiev in the beginning was pediatric ambu bags. And, probably a lot of the people are going to be watching this, they'll know what that is. It's that bag that you squeeze to help someone breathe.
Yeah.
Well, and you do it because you don't have the ventilator, or you're doing manual, basically, respirations for helping someone breathe. Well, I opened up one of those just to kind of see what, a pediatric ambu bag would look like, how big it was. And the mask was so small. And to think that one of the needs for the Ministry of Health for this country in a war was, we need the means to be able to breathe for infant children. That's because right. We're not going to have power. We're not going to have generators. We're not going to have the ability. I mean, and when you see that mask and you realize how small that face is, it just hits you in the gut, and it makes you want to, it makes you want to keep doing more. And so we try to find things like that to overstuff these ambulances. And then what we'll do is we'll get them from the United States, wherever they're at, to our staging locations. We'll get them to a port. The first 5 we flew on an airplane, but now we put them on a ship, and we get them to our port on the East Coast. Then they go by ship to Germany, and then from there they're trucked to a staging location in Poland. And then on many of the occasions, I've taken teams of Americans over. We partner up with some Ukrainians. We get a Polish military or police escort to the border. And then we drive the caravan or the convoy of vehicles, of ambulances and fire engines, depending on what it is, across the border. And then we go across Ukraine delivering ambulances to military units that we've identified, or hospitals, or other entities that might need them, that we've identified through either the Ministry of Health or other entities within the Ukrainian government. So that's basically how it's done.
Amazing. And I also want to touch on, through our conversations, you've also mentioned that there is a logistics company here, a Ukrainian logistics company that has been very instrumental in providing the logistics and moving things around. So that, just wanted to make sure that we kind of address that. The other thing is, can you mention any of the other If you can, of course, mention any of the other hospitals or any HA members that have, participated, that have, given their permission to say what they've done. Because I know, some of them, I want to remain anonymous, which is also, very noble. So
Yeah. So first of all, you're right. This wouldn't be possible without the logistical backbone or the support from North Shore Logistics. But they've formed a nonprofit, which is this UA Resistance Foundation, or it's UA I guess it would be UA hyphen resistance.org. And so, like, I'm not a nonprofit. I'm just Chris that came up with the catchy title. I'm on Twitter at US Ambulances
right.
US Ambulances for Ukraine, right? That's what I am, as a catchy title and everything. The nonprofit is this UA hyphen resistance.org. And so if anyone donates, then they're donating to a 501c3. So if there's if you're a private entity, if you're if you're a nonprofit, you're not worried about your tax exempt status, or you're not worried about your tax or about deductions. But if if it's a private ambulance provider or something, they can donate to a 501c3, and they'll get a letter with a tax ID number, and they'll be able to, if there's any value that they haven't depreciated, they'll be able to take that value for the deductions. So it keeps everything, like really super legitimate, and it keeps me out of anything. And it's a very clean process that way. And again, without them, we wouldn't be able to move this stuff. And Rotary, for example, International was good, and they helped us. Our last shipment of 11 vehicles, UA Resistance did all the logistical,
Great.
setting up,
Yeah.
and then Rotary then could donate. And again, it's just very clean. And then you mentioned donors. I mean, yeah. So yes, the first ambulance was a private. I'll tell you, this is a great story about AHA, and it's a good story about the people that we work with. So I told you the first story. The first ambulance was a private company. They said, "What do you want, diesel or gas?" Right?
Yep.
That's what got it started. But the momentum came after we got that first ambulance on a 747. I started getting calls from the Ukrainian government. I started getting calls from other NGOs. Chris, do you have any more ambulances? This was March 29th. Hey, we have another plane on April 11th. We need it by like April 7th. Can you give me another ambulance? I will tell you, I reached out to a friend at another health system that they have asked to be anonymous. They are AHA members. And I told them, this is what I need. And this is no small organization. And they said, we're really bureaucratic. We're kind of big. It might take us a little while. Those guys, everyone there moved heaven and earth. And they got that. I asked, I think, on a Thursday for this ambulance. I told them I needed it by like Thursday of the next week. And sure enough, by Wednesday of the next week, we had that ambulance on a trailer. And it was really because of their generosity and they're willing to jump in that it became more of a thing that we could like keep doing it. Right. And so instead of having just one ambulance and being a kind of a fluke, we had one plane, we had an ambulance, we had a second plane, we had a second ambulance. And people are like, hey, this might have some synergy. But, they did it. Genesis has donated. Again, OSF's donated supplies. ProMedica donated an amazing ambulance out of Toledo, Ohio. I mean, just a lot of good people. And there's a lot of other health systems. And even our partners, the Virginia Hospital Association, those guys, they brought other groups together. And when we had an ambulance donated from an ambulance authority in Richmond, our partners there in Virginia brought other health systems together, and they filled that ambulance just full of supplies. So I mean, it's just been that kind of a reaction.
It's overwhelmingly what what we're hearing is that anytime that somebody has outreach to you, they have been filled with their compassion, with their generosity, and they have tried to move heaven and earth, like you said, to get this done. And just maybe shifting gears a little bit, I just want to touch maybe briefly. You've been to Ukraine multiple times already. Share with the listeners, like, what has been the reaction from the Ukrainian citizens, healthcare workers, and government officials that you have already come across with. And if you want to, name drop a few big names, feel free to do so, Chris.
No. I will just say this. I've been to Ukraine 4 times now since April. The people have been way too generous and gracious to me. They realize, I don't have to, they know what they're dealing with. It's existential. It's life or death. And I've talked to people, there. And for anyone that's listening, I mean, if you were to ask someone in Ukraine, what are you fighting for? And it's very simple. We just want to be free. I mean, and I'll tell you, and when I first went there the first time, probably the biggest impact I had, I met somebody that had lived when the Soviet Union was still in existence.
Yep.
And they just say, hey, look, we've lived through that. We don't want to go back to that. We know what freedom is and we want to be free. And, when you see that, you can't help but react to that. And so people have been just amazing to me. They've been very appreciative of the effort. Many of the ambulances we send over have writing or messages of hope or other messages of goodwill. And I've seen men, women, and children in Ukraine get tears in their eyes when they read some of these messages. You actually see them. We'll bring the ambulance in and you'll see them put their hands up and they'll literally like touch the ambulance and they'll touch the words. And it's like, it's a connection to the outside world. It's hope. We're not alone. And it can be, sometimes it's just incredibly moving, the situations that just develop. I mean, it really, it's amazing.
I think this is the first time in the Ukrainian history that that they felt this overwhelming support, especially from all over the U.S. But I think this is also the first time that both of our nations have come in contact and so close and united and again, like you said, we want to be free, freedom and liberty, right? Pursuit of happiness, right? I mean, we could probably take our Constitution and lend them some of our beliefs, and so this is very moving, and and as you're talking about this, it's hard not to be moved by this. But what else can we do, Chris? What can the AHA members, AHA, any of the listeners of this podcast, anyone in the healthcare provider space, tell us what else we can do.
Well, I think probably I'll say the first thing for me, what I would say is, if you're a health system or a hospital and you run ambulances, go take a look in your garage and see if you've got any used, ambulances. They don't need to be super pretty, but they need to be functional. And if you can kick the tires and they're a good ambulance, and you think you can, you think it's okay if I drive it from Poland down to Odessa or Mykolaiv, which is possibly what could happen. So please keep that in mind. I'll take it. And so that's one. And I cannot tell you, we've got 28 ambulances over there right now. We have the one fire engine. We're doing another convoy at the end of this month. We're going to ship out another 9 ambulances and another 5 fire engines. But the people I'm talking to are asking me for 140 ambulances. You've got hospitals, you've got military units, you've got other NGOs. All these people are trying to move wounded people, and your vehicle might not be in a military unit, but it could still be on the front line moving wounded. I mean, moving any kind of wounded. So if you've got a vehicle, let me know. If you've got supplies, trauma related supplies, we don't, nothing COVID related. We don't need masks, or we don't need stuff like that. But if you've got trauma related supplies, again, those are very important things. And then I guess the other thing is, if you're interested in, if you like the idea, you like the concept, and you want to help, but you're good on your supplies, or you don't have any vehicles, that uaresistance.org, they're the ones that are helping me move these vehicles over there. So if you want to, if you wanted to like donate, I've had people that come to me and say, hey, can I give you money, or can I give you cash, or can we make a donation? Again, I'm not taking it, but again, this 501c3 is so that it's all. All the I's are dotted and T's are crossed and stuff. So those are really the 3 ways. And I guess the 4th thing I'd say is, if this moves you and it speaks to you, you probably have a private ambulance provider that you work with, or you have fire departments that you work with. Just spread the word. I mean, and I got to tell you, just spreading the word, it works. I mean, that's my last several ambulances, and I just got a fire engine this morning because someone spread the word.
Yeah, and that's exactly what we're trying to do here, Chris, is to really spread that word. And we're also going to have, for all of our listeners, we'll have the link to our website. Basically, AHA has put to the help for the Ukrainian healthcare workers, but really, the biggest focus here is drive, ambulances for Ukraine. So there is a way that you are able to connect to Chris, directly through the email, through the Connect, and there will be additional information on that website as well that you will be able to see here. So, Chris, anything in the last words? Anything else that you want to spread the word? Because hopefully, we're gonna, have a lot of listeners after this podcast.
No, I mean, I think the one thing I would just leave you with, or leave the listeners with, is I think the people that when you do contribute, well, I'll put it this way: I've never had anyone say no. That's the other crazy thing. In the year, no one's ever said no. They might not have a vehicle, or they might not have some supplies, but they always end up saying, "Let me see if I can help." And what I've found is, so I get a lot of pleasure and joy in and seeing that the vehicles get over to Ukraine. But I got to tell you that there's also just a huge level of positive reaction that you get when when they donate an ambulance, and then I'm able to come back with pictures and say, "Hey, this is the unit. This is where your ambulance is.
Right.
Your ambulance is now, running calls in this community, or they're training on it, or they're doing stuff, and I'm getting feedback that it's moved so many wounded people."
Or it's been turned into an operating room right on the front line.
Well, exactly. Yeah, it's an operating room. You're absolutely right. Or so, but I think you cannot underestimate some of these ambulances. Like, for example, ProMedica, they took the ambulance and they took it to a few of their hospitals so their employees could sign the ambulance. It gave their employees a real connection.
Yeah.
OSF's employees, our mission partners, they brought in. We asked for quick clot, and it's like a clotting agent, and we asked for emergency blankets, and we had a ceremony. And I still get people saying, "Hey, do you still need more supplies?" I mean, you just be surprised at how much of a positive reaction you get once it's actually been donated, and that's been really cool too.
Chris, an incredible story from an incredible human being. Thank your daughter for really getting this ball rolling. And for anyone that says that, one person can't change things in the world, well, here's an example of how that's not true. And I'm personally very grateful. And I know a lot of people in Ukraine are very grateful. I think this is an incredible effort, and we're going to continue to support you. So again, thank you very much, Chris. And one other thing I'll mention is that hopefully we'll get to talk to you in the next couple of months, and that number has gone up from 29, hopefully, to the 100 plus that you've been asked by the Ukrainian Health Ministry. So we're going to do our best to get you there.
Well, thank you for this, and I know you mentioned Odessa before, and I've loved going to Odessa, and it's such a pleasure to be able to participate in something like this. Because really, I mean, everyone is just so great. The people of Ukraine are great. The people here in America that are Ukrainian are great. And to be able to just have a little part in this, it's just a real honor. So thank you for spreading the word, and thank you for giving me this opportunity today.
Thank you, Chris. All the best.
All right.